Welcome to The Explainer. Today, we are diving deep into a major public health challenge, one that affects millions and millions of people all over the world. We're talking about the hepatitis B virus.
And just to put this into perspective, take a look at this number. According to the World Health Organization, we're talking about an estimated 325 million people globally living with a chronic hepatitis B or C infection. That's a staggering number. Okay, so let's really get into what this means.
So here's what we're going to cover in this explainer. We'll look at what the hepatitis B virus actually is, how it spreads from person to person. We'll get into the signs and potential complications, how doctors figure out if you have it, and most importantly, what we can do about it. We're talking treatment and prevention.
All right, first things first. What are we actually talking about when we say hepatitis? Well, in the simplest terms, hepatitis is just an inflammation of the liver.
And the hepatitis B virus, or HBV for short, is a specific type of virus that really zeroes in on the liver. Now, what's interesting is that some people's immune systems can fight it off after a few months. But for a lot of folks, it sticks around and becomes a chronic, lifelong infection.
And what's really key to understand here is that viral hepatitis is just one of a few things that can cause liver inflammation, but it is a major one with a truly global reach. We see it's especially common in parts of Asia and sub-Saharan Africa. And a big reason for that has to do with historical rates of mother-to-child transmission, from before we had these amazing widespread infant vaccination programs.
Okay, so that brings up a really important question. How do you get it? How does this virus actually spread? Well, it's not like catching a cold. It's transmitted through infected blood and some other body fluids.
The most common ways it spreads are, first, perinatally. That means from a mother to her baby during birth. It can also spread through contact with infected blood, things like sharing needles. And another major route is through sexual contact.
And here's the really crucial point, something you absolutely have to remember. The age when someone gets infected matters a lot. A baby infected at birth has a staggering 90% chance of developing a chronic, lifelong illness. But for most healthy adults who get infected, they'll actually clear the virus on their own.
This is one of the trickiest things about hepatitis B. A lot of people who have it don't feel sick at all. That's why it's earned the nickname the silent infection. But when symptoms do show up, they tend to follow a pretty clear pattern.
So at first you might get what's called an acute infection. It can feel a lot like the flu, fatigue, nausea, maybe a fever. But the real long-term danger, that lies in the chronic phase. That's where the virus can just hang out, silently damaging the liver for years and years.
And this right here, this really shows you what's at stake. If it's left untreated, chronic hepatitis B can lead to some really serious stuff, like cirrhosis, that's severe scarring of the liver, and it dramatically increases the risk of liver cancer. But, and this is a huge but, with treatment, we can suppress the virus and pretty much stop that damage in its tracks.
So if so many people don't have any symptoms, how on earth do we find out who actually has it, right? Well, the answer is in the blood. It comes down to a specific set of blood tests.
The way doctors diagnose it is through something called serology. It's basically a fancy way of saying they analyze your blood for several very specific markers related to the virus. These markers can tell them everything, what phase of the infection you're in and what your immune status is.
Now, I know these test results can look super complicated, but this table breaks it down really nicely. For instance, if you're positive for something called the surface antigen, or HBsAg, for more than 6 months, that confirms you have a chronic infection. On the flip side, if you're negative for the antigen, but you do have the antibody, that's anti-HBs, that means you're immune, most likely because you got the vaccine. See? It's like a little code. Okay, let's get to the most important part of this whole story, the good news. What can we do about it? Well, hepatitis B is both treatable and preventable.
Now, when we talk about treatment, the goal isn't always to completely cure the virus, which can be really tough. Instead, the main objective is to suppress it, to knock it down and keep it down long term, so it stops causing all that damage to the liver. So, how do we do that? Treatment usually involves a daily pill and oral antiviral medication like tenofovir or entecavir. And what these drugs do is pretty clever. They basically stop the virus from making copies of itself. They inhibit its replication. For many people, this becomes a lifelong medication to keep the virus in check and protect their liver.
But really, treatment is one thing, prevention is the absolute cornerstone. There is a safe, powerful vaccine that can stop this infection before it even has a chance to start. And that first dose for newborns, the birth dose, is so critical for stopping mother-to-child transmission. Remember, that's the most common way people end up with chronic infections.
So when you really understand this virus, it stops being this scary, silent threat and it becomes a manageable health issue. And that's the real key takeaway here. Through vaccination, through testing to know your status, and through effective treatment, we absolutely can control hepatitis B and prevent its worst outcome.